Well, hello everybody. My name is Gustavo Tolose, and I am the webinar moderator for Dr. McDougall. And today we are very thankful to have you, Dr. McDougall, talk to us about pregnancy, sperm count, and have questions and answers later on. The chat is open now, but then while Dr. McDougall talks, it will be closed, and then later on it will be open again, so you can ask questions directly to him. And thank you, Dr. McDougall. I'll pass it on to you, and please tell us a little bit about what you do for those people that are new in the call.
Well, first I want to thank you for the stimulating title for this webinar. It's got to cause some attention, and people will want to listen to this much more than weight loss, I think. I'm a medical doctor. I'm a board-certified internist, for those who don't know. I've been trying to fix people by changing their diet for almost 40 years. You could go to my website, drmcdougall.com, and you can view very quickly what I believe. I believe the people in the United States and other developed countries in Europe and Australia and New Zealand and now China and India, they're suffering from food poisoning. And the source of food poisoning is animal foods like cows, pigs, chickens, even fishes, and also vegetable oils. This has been going on for in great intensity for at least 35 years. And the solution to the problem of food poisoning is to go back to the traditional diet of human beings, which is a diet based on starch. I know it may shock you, but if you stop and think about it, people throughout all of verifiable history, and this is now going back hundreds of thousands of years, we have scientific and archaeological findings that show that human beings throughout the world live basically on starch: rice, corn, potatoes, barley, beans, peas, lentils. And sure, they ate animal foods. They ate whatever they could get their hands on. But the easiest food to get, the most productive food, and the food that people lived on in bulk, like 90% of their diet, was starch. Rice, for example, in Asia. So my simple approach is to switch people from the food poisons to a starch-based diet. And in the process, I have to take them off most of their medications. Remember, I'm a medical doctor. And I have to discourage them from being involved in the medical business. That's a good enough introduction. What I want to talk to you about today is our reproductive side for both men and women. And the ultimate result would be a healthy offspring from a healthy pregnancy. I mean, that's what it should be. But unfortunately, it's not. Unfortunately, in this world, and we're talking about the Western world, pregnancy is paramount to a disease. Pregnant women are sick women. They're overweight. They get diabetes and high blood pressure and kidney problems and swollen ankles and can't work, can't function. And this is typical. A pregnant woman is a sick woman in the Western society. A weight gain of 60 pounds is not unusual. Let me just go through some basic slides for you. This is a slideshow. Actually, you can find the whole discussion, whole presentation on my website as a video. You just look under education. Let me just go through briefly, and I'm going to really try and make it brief, some slides that may help us understand what's going on in terms of the different issues.
Yes. While you find the slides, let me remind people to go to your website, drmcdougall.com, because you have all this information there free for them to have access to.
Yeah, it really is free. In fact, there's I think it's my January 2011 newsletter. Is that the one? Anyway, we referenced it in the website. There's a whole article on a pregnancy that you can go to. And
right.
If you're interested in more details, and also all the scientific references, please understand what I'm talking to you is what the science clearly says. You will not find dissenting scientific points of view. You'll find that what I've told you is what the research shows. I have the right to talk to you about pregnancy and
parenthood. You do.
Because I have a good-sized family. In fact, we have one more addition to our family since this picture was taken. And of course, I say that with sincerity, and for you to put it in perspective, I've had to deal with all of these issues, not only with Mary and I, but with our children who have grandchildren. And fortunately, they've understood, our children, of the importance of a good diet. Now our grandchildren are understanding the importance of a good diet, and they will pass that on in their life. And on the male side, what you eat has a big impact on your fertility. What you eat determines your ejaculate volume. What you eat determines the mobility of the sperm, and also the efficiency of the sperm as far as whether or not you will get a woman pregnant. The quality of the sperm directly determined by what you eat. Some of it's the food, and a lot of it are the chemicals that are present in the food that people eat, the rich American diet. These chemicals in our environment get sucked up into our body fat from eating primarily animals. They start out on the ground or in the sea, and then the animals, pigs and cows and chickens and fishes, they eat the vegetation, the algae, the grasses and the grains, and these chemicals bioaccumulate in the animal tissues, and then people on the Western diet eat all of this animal food, and as a result, these chemicals go into their body and affects greatly the quality, the quantity, the function of their sperm, and also these chemicals result in changes in the genetic material in the sperm that lead to diseases as serious as Down syndrome. Oh, let me get back to this one. One thing I want you to notice about the human being is the human being has a particular kind of anatomy that tells us that we are plant eaters. And if you look at the picture I have up here, you'll see something called a seminal vesicle right below the bladder. The seminal vesicle is where the male stores the semen. And what's characteristic about herbivores, plant eaters, is that herbivores have seminal vesicles, whereas meat eaters don't. Well, here's the exception. The human being is a meat eater with seminal vesicles. So there's got to be something wrong here. Either we shouldn't be meat eaters, or nature made a mistake and given us these seminal vesicles that store the semen. So let's go to the woman point of view. A successful pregnancy is highly dependent upon the diet, and the right diet for a woman to have the best outcome in terms of her pregnancy is a diet based on starches, vegetables, and fruits. But that's not what you hear. What you hear from your doctors and dietitians is that the best diet for a pregnant woman is one with lots of calcium and lots of protein. So you need to eat lots of meat and lots of dairy. But think about it for a minute. Most babies born in the world have been born to mothers that ate a starch-based diet. Billions, like 9.5 billion babies that have been born on planet Earth, their mothers ate a diet primarily of rice, such as those in Asia, or corn, such as in the Mayans and Aztecs in Central America. The right diet for a pregnant woman, a healthy outcome for the baby, has always been eaten up until modern times when people have switched to all the rich food. The Western diet is an impossible diet for a woman to follow. When she's pregnant, when I was a young doctor, I was told to watch carefully the pregnant mothers and make sure that they didn't gain too much weight. They were eating the American diet, so they had to calorie restrict. And that was our general recommendation, is for moms to not gain too much weight. Maybe you could gain 20 pounds during your pregnancy. But what we found out is when you restricted calories for a pregnant woman is that the babies came out small, and small babies didn't do well. So about 25 years ago, doctors, because of this error they saw in causing small babies from eating too little, they told women you can eat as much food as you want. And the result is that women now, because they're given that recommendation to eat as much food as you want, and because it's the Western diet, what happens is the women get very fat. They get very big. They gain 40, 50, 60, 80 pounds during a pregnancy. And the consequence is the baby also gets big. In fact, so big that the mother has trouble with delivering the baby. Well, what happens is because the babies are too big, they can't fit out the birth canal. They're just too big. The babies When I was born, a typical baby was 5, 6, 7 pounds. Today, babies are 8, 9, 10, 12, 14 pounds. And because they're so big, they can't fit out the birth canal. And the consequence is they have to be taken out through the mother's abdomen. In other words, a cesarean section. Doctors call this fetal pelvic disproportion. And the result is failure of progression in labor. And it results in emergency C-section. Well, that's not the way it's supposed to be. Babies are supposed to be the right size. Mother's birth canals are the right size. It's all supposed to work, but it doesn't. And it'll never work. The point I'm making is back in the early days when I was a young doctor, we told women to not eat enough food on the Western diet. It didn't work. The babies didn't turn out well. And now we tell women to eat as much food as they want on the Western diet. It doesn't work. The babies turn out too big. You should be coming to the conclusion that there's something really basic wrong here, and that's the Western diet. Too little or too much of it results in a bad outcome for mother and baby. So how do you fix it? The way you fix it is you go to the traditional American diet. You go to the traditional diet of human beings, not the American diet. In other words, the diet's based on starch, vegetables, and fruits. So we have this very high cesarean section rate. In other words, taking the baby out through the abdomen. About 32% of the births in the U.S. are cesarean section, whereas the cesarean section rate should be down around 5%. In some parts of the world, like in Brazil, the cesarean section rate is 77% of the babies are delivered through the mom's abdomen. There's a real important article written in 2003 that explains this, that there's got to be something wrong. And the title of the article is Darwinian View of Obstructive Labor. And what Dr. Royce said is evolution is essentially survival of the most reproductive fit. In other words, those people who can reproduce, deliver their babies, there's the ones that get to pass on their genes. And it makes no sense at all that we would have this problem where the babies are too big. It has to be a consequence of something we're doing wrong, and what we're doing wrong is feeding mothers the Western diet, and it can be fixed. The average time that a baby spends in the womb is decreased in the U.S. because of complications of pregnancy, decreased by about 7 days, and the result has been a bad outcome for the babies and the mothers. In the U.S., we have double the rate of women dying during delivery between 1996 and 2010. Let's talk about another subject in pregnancy, and that's morning sickness. Morning sickness is a natural consequence of eating unhealthy food. It's a protective mechanism that the body uses. When you eat the Western diet, the woman gets sick and can't eat. The body's trying to protect her and the unborn baby. And so the way you fix that, and what you find is in societies that eat a starch-based diet, morning sickness is very rare. But in the Western diet, women who get pregnant, it's typical to have morning sickness. And the reason is it's just the body trying to protect itself from all of this poison. The Western diet, as I told you, accumulates all kinds of chemicals. We talked about that a couple of minutes ago. It's with biomagnification. You have these chemicals on the grains and other vegetable matters, and the cows eat these foods, and then it's passed up to the mother, well, to all people. And the end of this food chain, the one that gets the highest concentrations of chemicals is the little baby suckling off of mother's breast. Oh boy, fish. Oh, that's a picture of me. Well, that was when I was a young man. I used to be a fish killer until I became aware of what I was doing. Well, let's talk about fish and omega-3 fats. Mothers are told that they must get enough omega-3 fat, essential fat, or the baby will have brain problems, eye problems, all kinds of problems. Well, this again is untrue. I mean, they need the omega-3 fats, but where they get the omega-3 fats from is the original source. No fish makes omega-3 fats. No other animal makes omega-3 fats. Only plants make omega-3 fats, which is, you can see from the picture, that's a double bond at the 3 position, carbon 3 position. The reason fish have omega-3 fats is because they eat algae or other seaweeds. Oh, let's just go past this. The The fish that women are told to eat when they're pregnant are so toxic that grocery stores around the country have to have warning signs like this one that's present in California, warning that swordfish, shark, other types of fish are so toxic in these environmental chemicals that people have to be warned, particularly pregnant women, to not eat these. However, the fish is every place and people don't heed the warnings. It was an interesting report done by New York Times where they ran around to restaurants and bought sushi, and they found that 6 pieces of sushi had so much methyl mercury in it that it exceeded the toxic levels that the FDA and EPA are concerned about. Fish, which are told to eat, adversely affect pregnancy in many ways, not just the chemicals. Eating all of this fish, because of the omega-3 fats, actually prolongs gestation. The woman's pregnant longer. The babies are born bigger, which increases birth injuries and risk of cesarean sections. Increases the risk of infant mortality. So eating this fish is not only a problem with chemicals, it's just that the fat and the types of fat change the biochemistry of the pregnant woman to the point where she has more complications of her pregnancy. Fish. That's a picture. I shared this couple personal things with you. This is actually a picture that was painted for me of a scene that I was in with my children, Cocos Islands. These are sharks, yes, real sharks, and we had a chance to spend about 15 minutes in this bait ball with these sharks, one of the most amazing experiences that I've ever had. And what I worry about is that my grandchildren will never get a chance to see this because of the recommendations that fish is so important in the diet. Since I was a young boy, say 12 years of age to now, 90% of the fish have been taken from the ocean. They're almost gone. All right, problems of preeclampsia. This is where women develop high blood pressure, kidney problems, and so on, are a direct consequence of eating the Western diet. Women who eat a healthy diet, in other parts of the world, a starch-based diet, they don't get this hypertension, kidney disease, swelling, can be a fatal problem. They just don't get it. There was one study published on a group of about 775 vegan women living in a place called The Farm, which is in Tennessee. And they studied these women during pregnancy and found that there were actually no cases of preeclampsia, no cases of this common high blood pressure problem, which occurs in about 10% of women who are pregnant on the Western diet. As far as pregnancy is concerned, I recommend you don't take vitamins, prenatal vitamins. They increase the risk of damage to your child. For example, 10,000 units of vitamin A causes malformations in 1 in 57 babies, results in all kinds of complications of pregnancy. You need to get your vitamins from their original source, which is starches, vegetables, and fruits, not from the pills. So that's the perfect diet. I think that's where I'd like to stop in terms of showing you a few slides and see if you have any questions. You can have a presentation, both in a newsletter on pregnancy that's on my website, as well as a lecture that lasts about an hour, hour and a half if you want to find out more. But I hope I've given you clearly the bottom line, even though it seems sacrilegious. It seems just absolutely crazy for me to recommend, or for me to tell you the science clearly shows, and all of human history clearly shows, you shouldn't be eating these dairy products or the meat products. You should be eating a diet that's starch-based with fruits and vegetables. The only other addition I would make is that I do recommend that pregnant and nursing women consume a vitamin B12 supplement. That's it. Otherwise, starches, vegetables, and fruits. So do any questions from the audience about this?
Yes, many questions. So what I'm going to do is start with some of the questions that people have submitted already, and I will go ahead and open the chat box so that people can start typing questions. But there, Jamina asked a question I think you're already answered about taking a prenatal in the first trimester.
Right.
It's difficult to eat much food, she says. But I think you said
you should not do this. This is toxic. This is hazardous to you as well as the infant.
All right. Good.
And the research shows it. And if you want to look at the research, again, go to the article that I wrote on pregnancy. All the references are there. With today's modern technology, you can You know, you can just go to Google or PubMed. You can see that the science says this, and really, your doctors and dietitians should be doing this. I've lost your voice.
Okay, here we go. Stephen says, do you differentiate between long chain omega-3s and short chain?
Well, the alpha linoleic acid is your ALA, is the short chain that's made by plants, and then fish and other animals can elongate this basic essential essential fatty acid. But as far as differentiating in terms of health aspects, they do have different pharmacologic aspects. I'm not sure what I could add more to the question.
Okay. All right. Maybe he can clarify here in the chat box. Frank says if this will be available offline. Yes, Frank, this replay will be available, and you should receive an email later on. Courtney says, protein during pregnancy, is the 75 grams per day really necessary? I know I'm falling short of 75 grams requirement, and I feel so guilty.
Well, this is 75 grams is an exaggeration. It's not based on history or on science. Remember, most babies ever born in the world were born to mothers that ate a diet based on starches, vegetables, and fruits, which gives you about 40, 50, and well, you can get 75 grams of protein if you add beans, peas, and lentils, but it's not necessary. It takes 2 pounds of protein, 2 pounds of protein to grow a baby. That's it. It takes 80,000 extra calories to grow a baby, but it only takes 2 pounds of protein. I've never seen, nor has anybody else ever seen in world history or ever reported in the scientific literature, any case of protein deficiency in a mother, or I don't know what of course it wouldn't occur in the baby, during pregnancy of women living on a starch-based diet. Remember, I mean, think about this in the big picture. You've got 2 billion Asians. Up until 1985, 90% of their diet was rice. You've got an entire continent of Africa that was consuming a diet of millet and root vegetables and potatoes, corn recently, and having lots of babies. A typical African woman would have 10 babies during her lifetime. So this is unfortunately misinformation that is perpetuated. And the root of this dishonesty is industry. It's the meat and the dairy industry, and they're at it all the time.
Right.
Educate the dietitians, the doctors. They're working on the dietary guidelines for Americans that are supposed to come out in 2015. The dairy industry and the meat industry are actively lobbying, putting huge amounts of money in to trying to get Americans to believe that the rich Western diet is good for them in the face of the fact that everybody's fat and sick. Think of the big picture. Think of how things have always been. And then you'll realize that eating all this meat, all this protein, all this calcium, there's something got to be wrong, especially when the outcome is so many fat, sick people, particularly pregnant women. Pregnancy is supposed to be biologically the best time of a woman's life. She's supposed to be at her peak physically, mentally, and emotionally. That's her greatest time in life in terms of her biologic purpose. And yet, in our societies, she's in the worst shape of her life. She's hungry when she's pregnant, and she eats more, and all that's available, or what most of what's available, is what her doctors and dietitians are recommending, which is eat more meat, more dairy, and it's just perpetuates horrible outcomes.
Right. Okay, Dr. McDougall, what can I tell my healthcare provider, someone says, who thinks that the Brewer diet and research is an excellent example for what a pregnant diet should look like?
You know, that's all a long time ago. Dr. Brewer's research on pregnancy high protein diets, that must come from 40 years ago. How can something like this continue to be taught? Anyway, it's been a long time since I've read his papers and his research. What you can do is you can present to your health advisor, you can present the things that I've talked to you about. As I said, all the references are there. Eating a high protein diet, if that means eating more meat and dairy, I mean, just stop and think about what I told you in terms of the pesticide load. I wrote a newsletter a couple of months ago about the Inuit Eskimo, and explaining because they eat so much meat up in that area of the world that the body tissues of the Inuit Eskimo and the breast milk of an Inuit Eskimo woman, they're so loaded in pesticide, they're considered a toxic waste hazard. And the breast milk of these Inuit Eskimo women, they have 5 to 10 times the pesticide load as a woman in, say, southern Canada. Just the pesticide issue alone should cause any doctor to say, any dietitian, anybody say, look, there's a problem here. I would start there, and the evidence is clearly available. Just say, how did you get 2 billion Asians on rice?
Yeah. No. All right. Laura says, is there benefit to treating gestational diabetes with insulin?
Gestational diabetes is caused by the Western diet. What happens when you treat for somebody with gestational diabetes, essentially has type 2 diabetes. Their pancreas works just fine. They become insulin resistant. Their blood sugar goes up. So the doctors, just like with the type 2 diabetic, prescribe insulin. Insulin has many adverse effects, including making the woman who's pregnant even fatter. Are there benefits? Yeah, the blood sugar goes lower. Are there hazards? Yes, the baby gets bigger and fatter, and so does the mother. What I would do, and of course what I'm clearly recommending, is that if somebody is pre-pregnant or pregnant or has gestational diabetes or whatever, they stop the cause. The cause is the food poisoning from the animal foods and the vegetable oils, and switch to what causes good health and good outcomes in terms of pregnancy. Switch to rice, corn, potatoes. You don't have to add beans, peas, and lentils. You don't need the extra protein, but you can. And some vegetables and fruits, add a vitamin B12 supplement. And that's the prescription for an excellent outcome for the mother and the baby.
Right. Okay. I cannot pronounce the name of, I'm sorry, this person is ABHAS, APAS, maybe. I am asking how to increase sperm count, if there are any specific foods that one can intake or precautions to take. Any magic pill?
Believe me, this should be a topic on any man or woman's discussion board. This is a big deal. The volume of the ejaculate, the sperm motility, their function, the lack of genetic abnormalities present. Yeah, the way you do it is you stop consuming the animal foods, which are loaded with environmental chemicals that have estrogen-like effects and other hormone adverse effects that cause the sperm count to be dramatically decreased in men who eat that diet. So you just got to stop the food poisoning. And again, the research is there. It's in the pregnancy newsletter. You can go look up the studies. And this is reported quite often because it does hit, just like the title you put for our webinar today, Gustavo. I mean, this is a big topic when a research paper comes out discussing a man's virility. It gets everybody's attention. And this is not a hidden message. This is not hard to find. This is not something that's controversial. The sad thing is it's something that people don't seem to react to enough. A very serious problem.
Right. And I think that a lot of times people just listen to what their friends say or someone say rather than looking at the actual science, like you're saying. I think it would be great for people to go to your website and get those actual studies that you have there.
Right, they can do that, and that's what they should do. The really interested person, you have to realize that the meat and the dairy and the other food industries, they're just doing business, and right. So they're going to take anything that slightly, or they paid for a lot of the research that favors the sale of their products, and they're going to make sure it makes all the media headlines. But if you'll just stop for a minute, if everything I've said is too overwhelming, if you'll just look at the big picture that I always try and give you, and that is, what have people eaten? What kind of foods have people eaten traditionally? They've always eaten starch-based diets, except for a few rich people or people living at the extremes of the environment, like the Inuit Eskimo. Otherwise, all the Asians, all the Africans, all the Mayans and Aztecs, all the Incas, they lived on starch, had healthy babies, fought wars, did athletic events. Start with the overall picture that you can see. Just open your eyes, you'll see it. And then you'll go to the science, and you'll see the science consistently confirms the truth. But you also see the tainting of that science by a lot of money.
Right. Exactly. Dr. McDougall, here's a question that has been asked before, but maybe since we're talking about pregnancy now, Erin says, I'm pregnant and I found out at 8 weeks that I am vitamin D deficient. My level is 2, even though I sit in the sun in Los Angeles every day. I also have celiac disease. Any advice?
You should read my March 2015 newsletter. Vitamin D deficiency is disease mongering. This is something that has occurred just in most people's lifetime. When we went to school, we learned vitamin D was the sunshine vitamin. Vitamin D comes as a consequence of getting sunshine. Your vitamin D status is excellent, I'm sure, if you sit in the sun. Vitamin D levels are low when people don't get enough sunshine. They're also low when people have chronic inflammatory diseases, because inflammation lowers the D level. What you'll find when you read my March 2015 newsletter is that that vitamin D does not benefit in terms of preventing fractures, except in extreme case of deficiency, which is elderly, white, institutionalized women. And you'll find that there have been two only large randomized trials on vitamin D supplementation, and both of them show an increased risk of falls and fractures. This is a very toxic message. You do need sunshine, pregnant or not pregnant. You should not be taking vitamin D supplements. There is no level of vitamin D in the blood where I would prescribe a vitamin D supplement, no level.
Right.
Always prescribe sunshine and stop the inflammatory disease processes, which most are caused by food poisoning from the Western diet.
Exactly. Thank you. Mooney says, is an algae supplement or a good substitute for omega-3 during pregnancy?
We're getting back to what I tried to address, and I know it was too rapid in the slide presentation, is omega-3 fats come from plants. Many people, dietitians, doctors, etc., they say, well, you need omega-3 fats, and fish are loaded with omega-3 fats, so you should eat lots of fish. And people who say, well, I'm not going to eat the fish because I don't want to kill all the fish, and they're full of these environmental poisons, so I'll eat algae supplements, which have omega-3 fats, or even oils that are derived from algae, they're full of DHA and so on. You shouldn't be doing this. You should just be eating the plants. You cannot develop essential fatty acid deficiency on a normal diet. It's never occurred. There's plenty of essential fat in corn and rice and potatoes and so on. This is just another bit of misinformation that encourages profits from from industries, and it scares women, and they get toxic from taking these omega-3 fats. Remember, I told you a few slides ago that these omega-3 fats, and I was talking about fish, but algae-derived oils are the same thing. These prolonged pregnancy, they result in a bigger baby. They result in more harm at the time of delivery, more cesarean section rates. These things are not just neutral, they're toxic to take these powerful prostaglandin-changing oils. They're dangerous.
Right. Dr. McDougall, Evelyn says, is 500 UG of B12 once per week still okay in pregnant women, since it is a rather high dose?
As far as I know, and I reserve my right to change my opinion on this, as far as I know, there's no problem from overdosing of B12. But I could be wrong. And all you need in terms of B12 is you need probably 0.5 of a microgram, but I've always recommended 5 micrograms of B12 daily. You can't buy in the store less than 500 micrograms, and most supplements are 2,000 or 5,000 micrograms. Taking 500 micrograms once a week, plenty. It's always going to solve the problem. And I do recommend a B12 supplement. As far as I know, you won't become toxic from it, but right now it's an issue that I don't have a final answer on, and I do recommend 5 micrograms of B12 daily, or you can take a little bit more once a week.
Right, right. What about iodine supplements? Are those any necessary at all?
It shouldn't be. The iodine comes from the soil and goes into the roots of the plants and becomes part of the plants. But there are goiter belts in the world. Like in Africa, there are still goiter belts. And in the Great Lakes area, about 100 years ago, we had goiter belts where the soils were deficient in iodine. As a result, people became iodine deficient. You need iodine, but you should be getting it from your plants, and you will. If you lived in a goiter belt, or for example, if you lived in a part of the world where all your food came within 25 miles of your village and the soils in that 25 miles were deficient in iodine, I mean, this is a problem, has been a problem. But for you and I and the rest of the people living in Europe and Australia and New Zealand, the United States, we don't eat from 25 miles of our house. We eat apples from Seattle, and we eat corn from Idaho, and we eat potatoes from, you eat foods from so many different places that it's never in practicality a problem of iodine deficiency.
Right.
So you should not be taking supplements.
Exactly. Well, I guess what some people may not understand is that if you're eating a really well balanced diet, like what you prescribe, then it's not an issue.
Well, well balanced is something I want to address. A potato is well balanced. The food is naturally well balanced. You can live, and millions of people have lived for long periods of time on potatoes alone. You can live on sweet potatoes alone, nothing else but sweet potatoes and water. You can live on rice, other grains, and legumes, not alone. You can make them the basis of your diet because grains and legumes are deficient in vitamin A and C. You'd have to take a little bit of fruit or vegetable, like a slice or two of orange, or a flower head of broccoli to get the A and C. Otherwise, the foods are naturally designed complete. Think about it again. If you look at Asia, China, for example, up until 1985, 90% of their calories came from rice. And you can look at history, throughout history, that's been the basic diet of human beings. Almost no meat, no dairy, no fish. If they lived inland, they lived off the land. They were farmers. So anyway, it's balanced by nature.
It is balanced.
You have a dietitian following you around. You don't have to be indulging in these excesses of protein and calcium. This is dangerous.
Right. Sibel says, do you think autism can be caused by diet during pregnancy, like too much milk or other animal products?
Well, there is some evidence that autism and schizophrenia would be a related issue, is caused by dairy products. And there's also some evidence that it's caused by gluten issues. But research on autism being caused by dairy deserves a tremendous amount of attention. And if you go to my website and you go under the search bar and you enter autism, you'll see a small article I wrote many years ago about the science of autism. In fact, there's a huge article that it references that you can get, maybe with some effort, but a huge article that reviews diet and autism. And you get that just by going to drmcdougall.com, put in the search bar autism, you'll find the article. It's in one of my favorite 5s. Then you'll look at the reference and you see the whole article talks about the review of diet and autism, and you can find that research. I wouldn't feed dairy to any person. We'll do a lecture on eating cow's milk. I don't feed cow's milk, whale milk, dog milk, cat milk, rat milk, any kind of milk to a human being other than human breast milk when the human being is less than 2 years of age. You've heard that before. It's a great cliche. No animal drinks milk after weaning, and no animal drinks milk of another species.
Very good. Thank you. Thank you. What about herbs such as ginger, curcuma? Are they safe?
Probably. Are they effective? I've never seen any benefit. You can spend your money that. The problem is the food. You're suffering from food poisoning. You've got to get away from the meats, the fishes, the chickens, the oils. I mean, I sound like a broken record, don't I? You can't fix these dietary diseases of obesity and heart disease and cancer. You can't fix them by adding drugs like the doctor's trying to do, or by adding supplements as the quote natural people try to do. You can't fix the problem until you fix the problem. And the problem is the food, and it's very simple. It's very inexpensive. It's kind to animals. It avoids animal abuse. It saves the environment. Excuse me, ladies and gentlemen. The truth is simple and easy to understand, and it's absolutely consistent.
Right. Thank you. Thank you.
Sometimes, Gustavo, I mean, I love the questions and the interest and so on, but I feel like sometimes I'm just repeating myself so much. I don't. But the answer is that, and the details I do know, and I will give you the details. But if you see me coming back to the same
thing
over and over thing, it's because that's what it is. It's like somebody asked me, well, I have a terrible cough and I'm wheezing. Should I take cumin to solve the problem, or should I quit smoking 2 packs of cigarettes a day?
Right.
I mean, no. Cumin probably won't hurt you, but I know what you need to do.
Exactly. What is your recommendation for vaccines, for example?
Well, I do have, I think it was last year, I wrote a newsletter on immunizations, and what I wrote about was the flu vaccine. I'm very much, let's just say, yeah, I am very much against getting the flu shots. In fact, I had an argument with a pharmacist in a pharmacy a couple of months ago, and she told me, you know, when you call the pharmacy, before you can even get to talk to the pharmacist, you have to hear an ad for flu vaccines. And when you go to the store, they have ads that say they'll give you 20% off on your groceries if you get a flu vaccine. It's just such a bizarre thing. Anyway, the flu vaccines are not effective, and the research is there. You can look it up in the news that it's not effective. They're a huge business. I don't recommend them. I don't take them myself. Other immunizations, though, I want to be very clear about this. All of my children, all of my grandchildren are fully immunized against tetanus, diphtheria, polio, hepatitis. These are real diseases, ladies and gentlemen. I'm a doctor. I've been in the doctoring business since 1968. I've seen tetanus. I've seen polio. I've not seen smallpox, but smallpox was a big deal when I was a child. If I could get smallpox vaccine, I would give it to my children and grandchildren. And you say, well, those aren't common diseases. I don't have to worry about that. And my answer is, today, maybe you don't, but you don't know what the world is going to be like next week. You don't know what germ warfare is going to occur.
Right.
The other thing is some of the diseases that people should be worried about that I do see are hepatitis B particularly, which is transmitted by close contact, by fluids. And you say, well, I don't have to give my children hepatitis B vaccine because they're so good. They're not going to get fluids from other people. Excuse me, ladies and gentlemen, wake up. Your kids are going to be sexually active. They're going to get tattoos. They may become drug users. You need to, don't throw the baby out with the wash water. Take every advantage you can. And immunizations, there are 3 things that have changed disease in the world. They're sanitation. 3 things changed the incidence of disease in the world. Sanitation, better nutrition, and immunization. And they're the only 3. Treatments haven't. Just those 3 things have changed the worldwide appearance of disease.
Okay, very good. How about one more question? Are you up for one more?
I'm good. As you said, we don't want to overwhelm the audience.
What are your thoughts about birth control? Someone is asking how it affects the body.
Okay, you're pushing me out of my area of expertise, and it's been a long time since I've been a family practitioner, but you kind of have to weigh the benefits and risks of a pregnancy in your life, and birth control has been something that's changed the world. I probably don't want to get into that, Gustavo, because it's such an emotional, religious thing for people. Exactly. One of the things that we have to do on planet Earth is we have to control the population. I mean, we're on a planet that can support, it can support maybe 2 billion people, and there are 7 billion people living on it. What are you going to do? And the same thing in your own personal life. I mean, it may not be time for pregnancy, and there are various kinds of birth control methods out there to use. And
right. Okay. All right. Good. What are your thoughts on soil depletion? I've heard this many times as well, and the effects on the vitamins in the fruits and vegetables.
Soil depletion doesn't affect vitamins, because vitamins are synthesized organic materials that the plants synthesize. So if the plant can't make all the vitamins, then it doesn't grow big enough to get into the grocery store. The problem would not be vitamins, these organic materials. The problem would be the inorganic minerals. And as I just talked about, there are places in the world where there are iodine deficiency. And that's really the only deficiency of mineral that I'm aware of any significance. There may be a couple of cases of zinc deficiency, but they're questionable. Otherwise, the soils are or were very adequate in their mineral content, but the way that the farming has gone and erosion and so on, things have changed. I think, as I told you, you eat from many parts of the country or the world when you go to the grocery store, and if one plant is slightly mineral deficient, then the next plant or plant that you pick up will likely have that mineral. So I don't see ever in my practice or any place mineral deficiency problems, nor do I see vitamin deficiency problems, except for the ones that are invented, like vitamin D deficiency, which is really a hormone made from sunshine. I don't even see B12 deficiency, even though there may be some cases reported. You're being focused in an area that's not going to result in good health for you and your family. The problems are not scurvy. You have no friends with scurvy or beriberi or pellagra. We don't have problems today in terms of deficiency. We have problems of excess fat and cholesterol and protein and contaminants. You need to refocus things to get control, but refocusing means low profit for industry.
Exactly, yeah. Dr. McDougall, I think we're past the 45-minute mark, so I'm going to give everybody the email address where they can email questions, and I keep them. And next week, we have one of those webinars that is a general question webinar on Thursday. So the email address is webinar@drmcdougall.com. If everybody, whoever wants to send questions there, sooner or later, your questions will be answered. So it's webinar at...
Don't let them overwhelm you.
No, I mean, I'll just keep them there and move them to a folder when they're done, when you've answered them. But please send them.
We're going to get a lot of questions answered. And, hopefully the material will be fresh enough and varied enough for people to keep listening. And hopefully you'll find it worthwhile to encourage your friends and relatives to listen to what we have to say. But it's going to be consistent in terms of diet. There are areas we'll get into that I am an expert on in terms of treatment of heart disease with surgeries and breast cancer. You were just telling me this Time magazine article about the terrible harm that's been done to women over the years by early detection of breast cancer and all the aggressive treatments of amputating breasts. And so we'll be talking about treatments, diabetic treatments, breast cancer, colon cancer, screening. We won't be just talking about diet alone, but the diet message is going to change, folks. It's the same for 40 years for me.
Exactly. Well, thank you, Dr. McDougall, for today, for giving your time. I want to say to everybody, we need your help. Dr. McDougall and I were talking earlier. We've got to change the world. You can help. You can be part of something bigger than yourself. This can be exciting. So whenever we have a webinar, please feel free to share that link everywhere you can.
And also, we want to add one other thing: is I'm still young enough to face the opponents. So if you have dissenting opinions out there, and people say, "Well, what Dr. McDougall says is not true," or is harmful,
bring them in.
Yeah, well, bring them to the webinar. We don't want a forum of just agreement. If somebody thinks differently, I'd like to hear their point of view. I would like to tell them why I think differently, just like the fish thing we talked about in pregnancy today and so on. This should all make sense to you. But everybody's telling you different. Well, bring those people to our webinar. In fact, write Gustavo at the webinar drmcdougall.com address and make sure we know who these opponents are so that we give them adequate airtime. Because there's nothing better at sorting out the truth than to hear, quote, both sides of the story and giving me a chance to say why what you've been told is incorrect, scientifically, logically, and then we can get some really interesting discussions going on. We don't just want agreement here.
Right.
Bring it on, you know.
Exactly. I'm sending everybody right now, you can see the website for you to go and register for next week's. I'm putting it right now there. You all should see it. When you click on that link, you can register for next Thursday's webinar that Dr. McDougall is going to do for the questions. And maybe we can get a guest if you have someone that you would like.
We might do that as time goes on. We can get a lot of interesting people out there to talk. Hopefully, we can make this a forum that makes a difference.
Exactly. We want to make a difference. Thank you so much. And we will see you all next week.
Okay. Thank you all. Bye-bye.
Okay. Bye-bye.